Across the state, Massachusetts public health officials have confirmed a case of monkeypox, the first in the country. The infected person is a man who recently traveled to Canada. This leading to questions about the virus and if it poses a risk to the public. Western Mass News reporter Kristen Burnell joining us live after getting answers. Kristen, what can you tell us?
Mary, I spoke with an infectious disease doctor at Bay State who tells me monkeypox is a rare but dangerous infection. However, people should not be alarmed.
On Wednesday, the Massachusetts Department of Public Health confirmed the first case of monkeypox this year in the Bay State and the United States. Western Mass News took questions to one local infectious disease doctor to find out what this disease is.
This is a virus that gives you an infection that can give you a rash, and the more systemic symptoms are very similar to the flu.
According to state health officials, the Massachusetts man who was infected recently traveled to Canada, and they are conducting an investigation in collaboration with the Centers for Disease Control and Prevention to find out where he might have contracted it. But Dr. Delpar tells us this case poses very little risk to the public.
This seems to be your run-of-the-mill monkeypox that is not that transmissible. Unless you're in contact with certain animals, your chances are almost zero. Getting it from another person is really unlikely.
Dr. Delpar says symptoms may include a flu-like illness, tired, achy, fever, lymph node swelling, and a rash on the face and body. He tells us there was monkeypox in the U.S. nearly 20 years ago.
If you go back to 2003, there was a little bit of an outbreak here in the United States about, I think it was like 19, not even 20 cases. That was associated to these prairie dogs that had come in contact with these animals that were coming in from Africa.
He says those who were infected were mostly children and recovered well due to having the smallpox vaccine, and he does not see this new case spreading further.
Travel is the most common way that we see monkeypox being expressed outside of the African continent. You really haven't seen much of it outside of the African continent.
Dr. Delpar is also encouraging people to talk to their doctor about any concerning symptoms that they might have. Live in studio, Kristen Burnell, Western Mass News.
All right, Kristen.